Hi, this is Dr. Catherine Vanderloos at NV Medspa, and we're talking about the myths of Botox today. And there are quite a few of those, and I had to go through all kinds of information to really get a better sense of it myself. The most important thing to know is that Botox is not immediate. It takes a few days, maybe even as much as 3 to 5 days to see the full impact. What Botox does is it blocks the signal from the nerves from one side of the nerve to the other side, and so that the muscle can't respond. So the muscle starts to relax, and the muscle is attached to the skin, and so that's how the lines are softened, and that's also how many of these lines can be prevented if you start early. This was total news to me in terms of prophylaxis or prevention of lines, but it really can make a difference. And talk to these younger people, you know. Botox is not permanent. It only lasts 3 to 6 months, and you really start to see the major change at about 3 months, but it can persist up to 6 months. So you want to make sure that you know what you want to fix and how you want to fix it, and how the medicine works. There are little tricks to it too. You shouldn't have bruising. You shouldn't have funny drooping or dropping of your eyelid. There are little rules about the anatomy that you should really see someone who's had good training in using Botox, because they're simple little rules that can avoid those things. Your post-op care or your Botox treatment is really important. You don't want to rub on the area for a few hours or wear a cap, or as my esthetician Don Matthews likes to say, don't swing from the trapeze, so that things can kind of stay in place and just work in the little area where you've placed the medication. Those are some of the myths that I had to learn about, and I'm telling you they are myths, and we can teach you more. Stay tuned. This is Dr. Catherine Vanderloos at NV MedSpa.